Across the Columbia and Clark County, health officials say unvaccinated COVID patients are now putting the most strain on hospitals there.
Ambulance services also bearing the brunt of this. Jenny Young live tonight. Jenny, you ask a basic question. What happens when a hospital is too full to receive a patient by ambulance? What did you find out?
Well, Jeff, it's something we have to be asking because hospitals are full, and I learned that the two hospitals in Clark County have been on divert status. We'll go learn what that is. They've been on that for a couple of weeks, and you know what? EMS might have to put you in the waiting room. You think when you take an ambulance, you're going to go immediately, be checked in immediately, and that likely is not the case right now.
We're not getting surged in 911 calls. The hospital is just already full, so we have nowhere to put them when we get there.
Sean Ford says when an emergency department becomes overcrowded, there's something hospital officials can do about it. They go on what's called diversion status, meaning they divert ambulances to other hospitals, allowing medical staff enough time to treat patients and clear out the crowd.
It's not uncommon, during peak time of the years, to where they each might do that for an hour or two a day.
However, Ford, who's the chief of North Country EMS, tells us Clark County's two hospitals have been so busy recently, diversion status has become the norm.
But it's been 24 hours a day, mostly for the last 2 weeks.
Coin 6 reported last Friday that Peace Health Southwest in Vancouver is seeing such extraordinary numbers of people, they've set up this tent outside their ER for patient overflow. Peace Health spokesperson Randy Querin.
We're having trouble discharging patients to other facilities like skilled nursing facilities. Even though we can't discharge on the backside, we're having people come in on the front side.
Hospitals up and down I-5 are asking people to go to the appropriate place for care. For example, they say don't go to the ER for a minor injury or illness. Instead, go to your primary care doctor or an urgent care.
We try to have that talk with them about, it'd be better to, make an appointment at an urgent care or to go to your primary care doctor.
Ford tells us in the last week, approximately 50% of their calls have been from people who've tested positive for COVID-19 and think they need to go to the hospital. However, he says many have mild symptoms, such as a cough or fever.
For most people, it's something that they can care for themselves at home as well. We'll definitely take them to the hospital if that's what they want, but we'll talk about other options for them.
So when should someone who's COVID positive go to the ER? According to the CDC, you should seek emergency treatment if you have trouble breathing, persistent pain or pressure in the chest, confusion, inability to wake or stay awake, pale gray or blue colored skin, lips, or nail beds.
Okay, and we've got to mention this. Now, he said that some of his EMS crews have had to wait anywhere from half an hour to an hour just to find somewhere to put a patient. He said, though, that's nothing compared to what they're seeing across the state. He says officials in Washington state saying some crews, EMS crews in King County, well, they've had to wait 3.5 to 4 hours. Reporting live tonight, Jenny Young, Coin 6 News.